Yeah, hello everybody, and thank you very much for your interest in another presentation of mine, entitled, in this case, The Facilitation of Adherence in Patients with Musculoskeletal Compliance to Sustainable Effective Physiotherapy. What you should know after this presentation, to answer this question, I provided a few key elements that I would like to show you step by step. We start with some basic knowledge about adherence to sustainable effective physiotherapy. But then we continue with adherence influencing factors and how they work. The knowledge about the measurement and, of course, the facilitation of adherence to sustainable effective physiotherapy will follow. And first, some background information. That means long-term pain management is influenced by adherence. Adherence is a multidimensional factor that influences therapy effectiveness, and a high level of adherence to self-management is required for sustainable effective physiotherapy. And because the term sustainable effective is very important for adherence, I would like to explain it specifically. Sustainable effective in this case means that it should be more than just the reduction of symptoms. When it comes to our therapy, it must be long-lasting, long-term effective, and ideal-wise resource efficient. And especially in clinical practice, it's sometimes difficult to separate compliance from adherence. And this is why I would like to explain these terms also specifically. Compliance means the patients follow the advices or recommendations of healthcare providers, for example, physiotherapists or physicians, etc., without any intrinsic motivation or interest. It's more like following an order. You can also say doing what the therapist or the doctor, the physician said. On the other hand, we have adherence, and adherence means the patients follow the advices, the recommendations of the healthcare providers with a high level of interest and motivation. But the good thing is compliance becomes to adherence when I must becomes to I want. And to understand the difference between adherence and compliance a little more extended, a little better, I would like to show you an example from clinical practice. And I think it's good if you use the handout. You will find the link in the description. And yeah, please read this by yourself, and then we take a closer look together. So, and here person A represents compliance, which is quite clear because there are no factors to identify that supports, for example, motivation or a higher interest in the therapy, etc. Person B represents obviously adherence because here we see some factors that are in line with motivation, that supports motivation, or also a higher interest in the whole process. For example, she said she had to turn herself down a little bit, not to do more. She asked some specific questions, etc. And to understand the mechanism, the functioning of adherence a little more detailed, I would like to explain to you that the adherence level is biopsychosocially influenced and therefore multidimensionally. But this means that the biopsychosocial approach is by far not enough to manage adherence sufficiently. Biopsychosocially means symptom intensity, for example, convictions, expectations, motivation of our patients, but also when it comes to ourselves, it's important to be motivated, interested, for example, in new research, in new strategies, etc. Multidimensionally means we have to our patients have to understand the exercises, the recommendations we gave them, or just think about something like, do they have enough therapy appointments? Do they have enough reminders, etc.? And because motivation has been shown as the most important driver for adherence, I created this little hypothetical model here throughout our research process. This is not validated, but it shows that we do not need some complex strategies to facilitate adherence at all. Sometimes it's enough just to give some positive hints, for example, yeah. For example, thank you for your trust, thank you for your interest in the therapy, etc. Because this increases the production of dopamine in our brains, and dopamine supports motivation, and motivation helps our patients to realize the benefits that they get from our therapy, for example, symptom reduction, performance enhancement, etc. And this leads, of course, to a higher level of adherence. But we should never forget, all these benefits are in conflict with some efforts. Yeah, our patients have to be active, initiative. Sometimes they have to leave the comfort zone, etc. And all these efforts could lead to a reduction of adherence. And then we continue with the measurement of adherence. Just a brief insight, because we are a little time limited. We extracted some relevant dimensions for the sufficient management of adherence in our previous research, and important is for them, they should not be up to the patient himself or herself. It's more that they are related to other persons also. Yeah, for example, the physicians, the healthcare providers, relatives, etc. Everyone who is influencing the patient. And the dimensions are the biopsychosocial approach, for example, motivation, symptom intensity, support, cooperation between therapists and patients. The understanding is important. Yeah, the trust, the sympathy, etc. Interdisciplinary cooperation. There must be a regular exchange, congruence or consens when it comes to the different therapy recommendations, etc. Administration should be simple, not difficult. Digitization must be understandable and available, because nothing is for free, neither apps, for example. And therapeutic competencies, I mean, this is quite clear, I think. The healthcare providers, especially the physiotherapist in this case, must be motivated, interested in new knowledge, new research, etc. But the measurement of adherence in physiotherapy is often one-dimensional, quantitative, for example, by counting exercises, therapy sessions, etc. And questionnaires can be used for the more relevant multidimensional approach in the measurement. And here I have two most relevant questionnaires in the musculoskeletal section for you. First, exercise adherence rating scale. This is this one here. I know it's very small, but I just wanted to show you that it's really exists. And the adherence to exercise for musculoskeletal pain tool. This is this one. That's the newest one, and I would like to recommend this for sufficient management of recent adherence, or in the recent time, because it's based on the newest evidence also. So, and then we continue with the facilitation of adherence. And in general, that means therapy should be developed together with the patient in a tailored, individualized, and controlled manner. We use for this the shared decision-making approach. And shared decision-making in therapy means that we try to include the opinions, or most of all, the experience of our patient when it comes to the planning of the therapy, or also identifying some effective, efficient strategies. Yeah, the advantage is that our patients feel more respected, and therefore we have the chance for a higher level of trust, for a higher, better relationship quality. And this leads to a more effective therapy and also to a higher level of adherence. But our patients have challenges. Most of all, the uncertainty about how to implement recommendations correctly. They have concerns about injuries, which is quite clear. If we have not enough time to explain sufficiently, of course, they don't know how to do. Maybe they are a bit worried about getting injured again, etc. And this leads to a reduction of adherence. And yeah, to understand to identify a little more extended, a little better how facilitation of adherence could work ideal-wise in typical clinical practice, I have another example for you. Again, you will find this in your handout as well, and the link for the handout is in the description. So please read this by your own, and then we take a closer look. So, and here we see the patient wasn't that amused with his former physiotherapy. He felt a little limited, evaluated. There were some non-answered questions for him, and that goes so far that he felt like a guinea pig. And we all know this is really not a good identification factor. So it needs some improvement. And the physiotherapist, the new physiotherapist, in this case, she tried to integrate all of these negative factors and try to transform them to positive ones. For example, here we see, "Thank you for your trust," she said. Yeah, this is a positive hint, and this is something I explained to you a few slides before. She also asked him about his opinion. Yeah, she made some own options and tried to combine this. Yeah, which is a great basis for a good adherence level. What should we expect, especially when it comes to sustainable effective therapy? This requires a personal initiative, and that means an effort. And it's like something really difficult, like leaving the comfort zone. When it comes to our patients, they have to leave the comfort zone and they have to change their behaviors. And to facilitate behavioral change, we need communication strategies. And I would like to explain to you 3 relevant communication strategies in physiotherapy. The most important one is motivational interviewing, and this is based on active communication. That means we should ask our patients open questions to get enough relevant information, and this should work like a orientation for the patients to understand in the end the causes of their problems, or also the positive, the negative influences, the opportunities, yeah, better by themselves. Then we have goal setting. Goal setting is based on the definition and achievement of smaller part goals. And then when we combine them, we have a good chance to achieve the final goal as well. But it must be feasible, realizable, and the patient must be integrated with his opinions, with his experiences, etc. Then we have explain pain. As the name says, it's based on explaining. We want to explain in an understandable manner, for example, the causes of the complaints, but also the influences, positive, negative influences, etc. And please note, information is the basis of education. And information, you can also call it as the heart of communication. And this is why these strategies are that important. And here I have the last little example for you here to illustrate motivational interviewing from the clinical perspective. And this is based on this story here. A patient with long-lasting back pain talks with his physiotherapist. The patient first rejects the therapist's recommendations for activity. And this is like, or you can equalize this to behavior change. So please read this again by your own or take a look in your handout. The link is in the description. And then we take a closer look again. All right, here, first of all, the patient expresses a concern. The physiotherapist understands this. She asked about his opinion. He explained an offer. The therapist made a positive conviction. The patient agreed, and the therapist tried to realize the received information for a possible strategy. And then we have a real chance. And this is what it's all about. So the last important point for today is the challenge or the challenges for physiotherapists in facilitating adherence, because it's not only that the patients are challenged, also the physiotherapists. For example, here, the first one, influence of other healthcare providers, for example, physicians that create some different recommendations because they are all different educated, they have different perspectives, and that could create some contradictions. And we have to manage these contradictions, which is an extra effort for us, of course. Demanding patients, that means every patient is an individual, and everyone has some different beliefs, expectations, etc. And these beliefs, expectations, etc. must not be in line with our expertise. So the likelihood of resistance is existing. And here the same thing, we have to deal with with the resistance, which is again an extra effort. Time-consuming bureaucracy, this is an obstacle for every complex strategy, especially evidence-based strategies. For example, individual or the development of individualized home programs, interdisciplinary exchange and cooperation, personal communication. All these more or less simple strategies need resources and especially time. So, and then in the end, I have a little take-home message for you to this topic, about this topic. Adherence increases the long-term and the general effectiveness of physiotherapy, for example, by using self-management approaches. Adherence differs from compliance primarily in terms of intrinsic motivation and is therefore more desirable. Compliance becomes to adherence when I must becomes to I want. So, and I would like to answer some questions if you have ones. And for this, you can contact me via email, no problem. I try to answer them. And yeah, thank you very much, first of all, for your interest.